question is to the Minister for Health and Aged Care. Today, hundreds of pharmacists have come to Parliament House to try to meet with government members. Many of them are in the gallery now.
Order.
Minister, why have government MPs refused to meet with their local pharmacists? And can the minister confirm that the government has brought forward the next community pharmacy agreement by 16 months?
Order. Members on my right.
Commence?
Order. The Deputy Leader will pause. Members on my left and right. The Deputy Leader of the Opposition. The Deputy Leader of the Opposition. I'm trying to help. Just pause. It would be really helpful if the Deputy Leader of the Opposition. The Prime Minister will cease interjecting. Order. The member for McEwen. I've just reminded members in the gallery not to be interjecting. I'll do the same thing for people on my left and right. I want to hear the question in silence, and I'd like respect shown to the Deputy Leader of the Opposition. And I'll give her the call.
My question is to the Minister for Health and Aged Care. Today, hundreds of pharmacists have come to Parliament House to try to meet with government members. Many of them are in the gallery now. Why have so many government MPs refused to meet with their local pharmacist? Can the minister confirm that the government has brought forward the next community pharmacy agreement by 16 months to now commence on the 1st of March 2024? And will this government finally listen to the voices of community pharmacy?
Order. The Deputy Leader was heard in silence. The Minister will be given the same courtesy, the same respect. The Minister has the call.
Thank you, Mr Speaker, and I thank the member for her question. Members of the Labor caucus have been meeting with pharmacists for the last several months. I've been engaging with my caucus and with members of the crossbench and crossbench parties about the feedback that they've been receiving from pharmacists now for several months. I can also say they've been meeting with doctors and with doctors' groups. And most importantly, I say this as a reminder to those opposite, patients and patient groups. The measure that we announced on Friday, that we delivered on Friday, that the Prime Minister's already alluded to, delivers cheaper medicines for almost 4 million Australian patients. 4 million Australian patients. Those with ongoing health conditions like heart disease, high cholesterol, high blood pressure, osteoporosis, and so many others besides. This is delivering on advice that those opposite received 5 years ago. 5 years ago.
Minister,
this cannot be on.
The member for Riverina. Everyone just needs to cool it. The Deputy Leader of the Opposition on a point of order.
Thank you, Mr Speaker. There is an important and relevant part to my question, Minister. Can the minister confirm that the government has brought forward the next community pharmacy agreement by 6?
Yep. The Leader of the House.
Point of order. The relevance point of order that can be taken once during an answer is not there for the questioner to say there was one bit of her question that was relevant, which is what has just been put to the chamber.
So far, the minister was asked about meetings, he was asked about timings, he's listing who he's met with, when he has met them and who, everything else. So, of course, he is being relevant. I appreciate the Deputy Leader would like him to be relevant to a certain part of the question, but under the standing orders, he is being directly relevant, and I ask him to continue.
Thank you, Speaker. I'm simply pointing out that members on this side have been meeting with all interests in this area, with pharmacists, the pharmacist lobby, with individual pharmacists and their electorate, but also with doctors' groups and patient groups. And have a look at what patients' groups said on Friday about the delivery of this measure. I've been asked question after question by those opposite about this measure, and not one of them has ever alluded to the interests of patients. Not one of them has ever alluded to the interests of millions of patients who benefit from this. I can say confidently, that those on this side have met with pharmacists time and time again to understand their view of this measure. Now, to the second part of the member's question, that is about the new funding agreement, or what we call the Community Pharmacy Agreement, I did confirm last week that we had agreed to a request from the Pharmacy Guild, the main pharmacy lobby group, to bring forward negotiations for that agreement, with the aim, if possible, of securing a new funding agreement by the 1st of March. Now, that commitment was contingent upon a decision by the Guild to stand down their campaign against this measure. Against this measure.
Order.
A reasonable person in this building might question whether that commitment is being delivered upon. A reasonable person in this building might question whether that commitment is being delivered upon. But that is a commitment that we have made, and we intend, if it's reciprocated by the other side in negotiations, to delivering over coming months.